So if an ulcer in your mouth hurts, it's okay?
Usually that's okay. If it hurts and it disappears after 1 month, it's not a big deal.
Oh, thank goodness. Mine
Yeah.
always disappears in less than 1 week.
You're healthier.
Yeah, means I'm steady, yeah? What if you just don't eat at all and starve to die? Since you're gonna eat and die.
Then you die from other starvation. A-N. Art as in
A-N.
peace.
Like, I thought it's An for angel. Because she looks like an angel. Hello everybody, it's 2025 and now we are here for a whole new season. Today I've got something really quite cute to show you all and you can see from this one. You know, I used to really hate sometimes going to the dentist. Like, who likes going to the dentist, bro? I think of a dentist like trying to like put a knife into my mouth. Why? But today I've got a dentist for you. A beautiful dentist that's here to speak to you about your mouth. Alright, so today we're going to ask here Dr. Marlene Teo! Hey, doctor! Woo! So, Dr. Marlene Teo. Wow, so what do you do?
I am a periodontist. Do you know what that is?
What is that?
What? Lawyer, you don't know.
What?
Okay. I'll make use of your law skills, okay? Periodontist means periodontist. So peri means around, odonto means tooth. So I'm actually not in charge of the tooth. I'm a specialist in gums and things that happen around the tooth.
Oh.
So I'm a periodontist.
I just heard the word tooth and I look at you, I think you look like a fairy, so I think it's a tooth fairy. Does that make sense?
I cannot do this.
Like after you finish all your dental school, right? Where do you go? Do you just go back to Ang Mo Kio?
So I joined like another big private practice. I
Okay.
worked there for many years. I
Okay.
learned a lot over there. And then I came out and then I met Sani and we
Sani,
together
okay.
with Sani
Right.
and two other people, we set up Dental.
Like UN dental?
A-N. Art as in
A-N.
peace.
Like I thought it's An for angel. Because she looks like an angel.
So the thing is that I'm actually very interested in regeneration. Okay, so this is my job as well, to regenerate things around the tooth. So in
Oh.
order to, so what I've learned in gum specialist, I
Yeah.
applied to myself. Like as a
Okay.
gum specialist, I applied to myself.
Okay.
For example, if you want to grow bone and gums back around the tooth that has been destroyed by gum disease, right?
Okay.
You actually have to start from the inside out. So that's why our clinic motto is as within, so without. So we emphasize very, very strongly on wellness. So I do exactly what I tell my patients to do. Like I take vitamin D, I go to the gym, and the whole point is that I want to regenerate stuff. So you can actually get your body to like regenerate stuff, and that's I would say that's partly why I
Looks so
look
young.
Yeah. And I use regenerative skincare products
Vitamin
as
D
well.
and
Yes.
Vitamin D and go to the gym?
Yes.
And regenerate
The bone.
the bone.
Yes.
This okay.
So
I mean,
these are all clinical studies. When you take vitamin D and calcium, which are the building blocks of your body, and this is great because it's like an orthopedic,
Okay.
segment as well. So you can, if you go to the gym by lifting weights, when you have the raw materials, you can actually build your bone density back. And when you build your
Oh.
bone density back, you actually have better gums. And I'm going to show you what like a tooth structure looks like. Okay. So when there's gum disease, you get
Okay.
periodontitis. So the bacteria actually can lead to inflammation around the tooth and the bone gets destroyed.
Oh, okay. So the bone, like which part of the bone get destroyed?
This is actually the bone.
Oh,
Yeah,
okay.
so
okay.
the bacteria like seeps in,
Oh.
and from an inflammatory standpoint, the bone actually starts to erode away.
Oh my goodness.
Okay, so if you want to stop this from getting worse, or you
Okay.
want to grow the bone back.
Okay.
Now, to grow the bone back and the gums back,
Okay.
the procedure is called gum regeneration or bone regeneration.
Oh yeah, I heard about that. Like what you call the receding gum line, right?
So receding gum line is gum regeneration.
Okay.
We can also regenerate the bone and gums
Okay.
around. So there are two
that's really cool.
different
Okay.
separate
Okay,
procedures.
okay.
But in order to do that, your body has to be healthy, right? Because if you want to construct something, you need like the raw materials.
Yes.
So in order to get the raw materials, I need, for example, vitamin D, which is a component of bone. You need a good immune system And then you need to be able to work out so that you want to load the bone. So the vitamin D and the calcium actually goes into the bone. It's not like floating around everywhere.
Okay.
So when you combine these procedures together with so we put in like a stem cell stimulator as well.
Oh, wow.
So we actually can, it's very similar to orthopedics. We put in a stem cell stimulator.
Okay.
We stimulate your own stem cells to grow. But if you can use vitamin D and weights to basically stimulate your own stem cells to grow back, you can actually regenerate the structures around the tooth.
Wait, how much vitamin D do you take in a day?
So it depends.
I thought we always have an overconsumption of vitamin D.
If you do a blood test, you will never overshoot. So there's like a very healthy range that you want to be in. Maybe like for the healthy range would be like 30 to 100. So you go above that, you get kidney disease. You go below that, you have a lot of immune system problems. You get depression, you get anxiety.
Depression.
You have poor bone structure, poor immune system. All these are studies. So getting your vitamin D into range is super important.
So what do you do to get more vitamin D?
So you can go into the sun, you can have a good diet, but the easiest, simplest way is basically take supplements.
Supplements.
And how much supplements you take actually depends on the blood test that comes back.
Okay. I see. That is quite complicated. I didn't know that we must take a lot of vitamin D. I stopped taking about vitamin D after I thought that we had too much of vitamin D in my blood. But I guess I should start taking it again. Right?
It depends on what your blood test shows. If you want to be really safe, you can just take 1,000 IU daily. So just one tablet a day.
Oh yeah.
Anti-aging.
Okay, there's vitamin D. Wow, that is so interesting. I'm mind blown. So, your key areas here actually, what you do include the gum, right?
Yes.
And about the tooth replacement.
Implants.
Implants. Yes. Yeah. Implants.
Because after gum disease, if you lose your teeth because of gum disease, you need to replace them. So
Okay.
you lose them.
Okay. Right. So,
Can't eat
all
more
right.
sweet.
Yeah. Okay. Cut me some slack. But anyways, we'll come back with some information about gum diseases and implants. So don't go anywhere. Stay planted. So you talk about gum disease, right? What is gum disease actually? What should we know about it?
Gum disease is basically a balance between the amount of bacteria that you have in your mouth versus your immune system. So I think that's the best way to describe it.
Wow, tell me more. I don't get it.
Okay, so like this is a tooth, right?
Okay.
So a tooth should be anchored in your head and your face with bone and gums.
Okay. Yeah.
Okay? So, but if you don't brush your teeth or you don't go to see the dentist, what will
Okay.
happen is that the bacteria will harden and become calcified.
Okay.
And it will form into black tartar.
Ooh.
Yeah, so tartar is basically like blackheads.
Yeah.
And they will sit underneath your gums
Ooh.
into the pockets.
Man.
I know, so it's like quite gross. Then this black stuff, right, will actually cause an inflammatory reaction in the body, and this will actually dissolve the bone around the tooth.
Okay.
So if you are very unhealthy, say like you have a very bad autoimmune disease or you
Okay.
have diabetes and your immune system is not working, right?
Okay.
So the bacteria will win and your inflammation like goes haywire. Then the bacteria will just eat away the bone and the bone will basically go around the tooth, will drop around the tooth. So that becomes periodontitis. Okay, so basically if your bone has not been lost yet, that is actually called gingivitis. So when you see those red things around your mouth, that's gingivitis.
I
But
can
once
relate to that.
gingivitis progresses into periodontitis, it's something very serious.
Oh, right. Do you think there's a way to it, like how long it will take to develop into that?
So it depends on your immune system.
Okay.
So there are people who don't brush their teeth but never get periodontitis because their immune system is so strong. There are
okay.
people who brush their teeth every day but get periodontitis because they have a really weak immune system. So again, you don't know when it's going to bomb. So
it's linked
It's
between
linked,
your body general health
Yes.
and your gum health.
Yes, absolutely.
Oh, now I get it. So you gotta keep your body healthy.
Yes.
Keep your gum healthy.
Yes.
Keep your gum healthy. Keep your body healthy.
Exactly. So it's bi-directional.
Right. Wow, okay.
This is lawyer like that.
Yeah, like that one, sweet one. Hey, but actually think about it. So means that the gum itself, I mean, like if let's say you floss every day, you have you brush your teeth regularly, and you wash your mouth properly and all kind of stuff. You see the dentist and so on and so forth. How come some people still can get like gum problems? I'm talking about myself. I used to be very teeth conscious. Like, I take care of my teeth really well. I can brush 3 times a day. But still, sometimes we do get it. And sometimes the dentist say, due to like too tight a space in my mouth.
Okay.
I don't know. So yeah, what do you think?
So I'm going to diagnose him like right now, okay?
Oh my goodness.
Okay, zoom in. So for example, like for someone like you, it's going to be very, very difficult to brush your teeth because your teeth are so crooked, right?
Yeah.
So for example, like you see that thing that's standing over there, like a normal toothbrush is not going to quite cut it. You can try.
No, it's okay.
It's not going to. So you need to see a dentist, and they can give you special instructions on how to, treat that gap.
Okay.
Or to make things easier, you can actually do braces to align your teeth so that it's much easier for you to clean.
Then braces happen like this. They told me that I gotta remove 4 of my healthy premolars. For what? God give me 4, you take out 4, just to put on braces.
Okay.
Will it really work? Will I still be alive if I take out 4? Or will I like pass out?
So, I am not sure that I would take out 4 for you, okay? So everybody has like a different opinion. But the reason why you need to take out teeth to make space is because you could possibly lose random teeth if you get gum disease because you cannot brush versus you control it and you take out like X number of teeth and then you align it so that you can brush better so you don't get gum disease and then, you can... So therefore...
But will you die if you pluck out a tooth? I mean, will you get like, I don't know, like I heard some people die after they get tooth plucked out, like they got too much blood loss.
I don't know which dentist you go to, but it should not happen.
Okay, so that's about gum disease. Right.
You can die from gum disease though. I mean, that's the thing. So this is a very serious matter. It's not that you can die from gum disease, but gum disease increases your risk of so many other issues.
For example?
Okay, so number 1, diabetes is a huge thing. Diabetes...
Gum disease cause diabetes?
Not cause, it's an association. So we cannot say that
not
it is...
a cause and effect linkage.
Yes. There are more and more studies coming out to say that it's cause and effect. But right now, we can very, very safely say that it's associated. So gum disease is associated with
In what way?
heart
How?
issues. In heart issues or diabetes?
Both.
Okay. So, for example, gum disease, there's a lot of inflammation, right?
Okay.
And you know that a lot of diseases are inflammation-based,
Okay.
right? So imagine if you have gum disease and like your whole mouth is like full of inflammation.
Yeah.
Those inflammatory mediators are going to travel in your bloodstream to affect other organs. So depending on which other organ is susceptible, you could end up with heart disease, diabetes, and a very big one nowadays is your brain. So Alzheimer's and dementia is actually associated with gum disease. And right now, the studies are even finding bacteria in the mouth, in the brain, in people with Alzheimer's. So these are statistically significant facts. So if you have gum disease and you don't treat it, you're increasing your risk of other chronic illnesses. So, you should.
I was almost
and like
falling
even
asleep.
cancer,
Okay. Oh yeah. Right. Cancer. But just like in that case, then what if you just don't eat at all and starve to die? Since you're gonna eat and die.
Then you die from other starvation.
I don't know, but like,
wait, we're all dying. It's just like what you die from, right?
You see, look at this. The dentist making us scared of her now. You tell me her to not be scared. You say you're gonna die somehow. Walao eh. No, then still say that she's angel, dental, all.
Ask me this kind of like rubbish questions, like the patient from hell, man. It's like, I was like, I go home.
Now I scared. You know, I saw this clinic before called Gentle Dental. I thought like, wow, dental not gentle enough one. I realized now I got another name, Undental some more. So I must give a very peaceful name. Now I understand why. Scary, yeah? I didn't know eh. But doctor say one ho, means it's quite true. So, doctor, tell us more about implants. Like, what is implants?
So if you are missing a tooth, right, whether this is in the front or the back, in the front you want to replace it so that it looks better from an aesthetic point of view. For the back, you want to be able to replace it so you can chew better. So when you are missing a tooth,
Talk about that. Hang on, like I used to think, right, that you can pluck out your bottom tooth and keep your top tooth until the dentist say that when you chew, you're gonna beat down on your gum because they got no chewing partner. Then I realized, oh yeah, that's true, huh? So what's up?
So if you don't replace this tooth, let's say this is a tooth at the bottom that you're missing, right? Your upper tooth is really going to grow down because teeth stop growing when they contact each other.
When they
meet each other.
Oh, like that.
Yes.
And they stop growing.
They stop growing. If you don't have an opposing,
if you have nothing here, what happens?
You know, it's like people in love. Okay, so if your partner is gone, right, the upper tooth don't have the partner. So you try to find. So it will try to find and it will grow and eventually it will smack your gum.
Smack, and then but we drop off.
It won't drop off, but you'll start chewing on your gum. So you need something to prevent that upper tooth from going down.
But what if like this? Like example, you see here, right? Here's empty. Here is filled like this one line, right? It won't touch.
If your tooth happens to be right smack here, it will go in.
Oh
Okay.
yeah,
What will happen is that it will twist and then part of the tooth will go in, or your adjacent teeth will fall inwards. So it's all about forces, logic.
Logic, right. So basically, it all like move naturally, right?
Yes.
I heard that your teeth keep moving.
Yes, your teeth always move.
Oh, move.
Always
Like
move.
naturally moving.
Yes.
How do you stop it from moving?
So you can do braces and then you wear a retainer after that.
Oh, retainers, yeah. That's
So as we grow older, our teeth keep moving.
Okay, cool. Okay, so that's the idea, but you must get an implant, right? So
You
what's
should. Or you need a replacement. I wouldn't say you need to get an implant.
Okay, so what do you have options you have for?
So
Replacement.
if you have a gap,
Okay.
so let's say you have too many teeth like you,
Oh,
then
yeah,
you can
yeah.
wear braces to close that gap.
Yes,
That's number one.
yes, okay.
Or you can wear a denture, which is like a plastic plate you remove at night. Okay, that's not so
Denture.
cool.
Sounds so old, right?
Yeah, it's a bit old, a bit
Okay.
uncle.
Right,
Okay.
it's
So
very young.
you
Okay,
want
yes, so?
something fixed, right?
Yes,
so once
yes.
you can
What do you
also
do?
cut the two teeth next to it, and you can
you
make
cut it off.
you can cut, you trim it, not cut, but then
Oh,
then you
trim.
you
Yeah,
trim.
yeah,
So it's
yeah,
like this, and then you like put on top. So this is called a bridge. So it's literally a bridge. It's supported by two teeth, and there's a fake tooth hanging over there. So this is called a bridge.
Okay.
But the issue with the bridge is that you have to cut down two good teeth in order to hang this tooth over here.
Yeah.
So what might be good is that you keep everything. Can you put back?
Okay.
There you go.
Yeah. I'm gonna do it like this.
Then you come over here and then you replace this gap, right? By
This gap here.
putting in a titanium screw.
Yeah.
So you must have good bone, and therefore we go back to vitamin D again. You
Right.
should get good bone
More
by
vitamin D.
more vitamin D,
Yeah.
and exercise. This is an abutment. This abutment gets this. If you look at it, there's like a hole inside, like the dental implant.
Yeah.
Okay. So it goes inside. It like this. So this is a dental implant crown.
Oh. And then that's it.
Is it?
I used to get my tooth trimmed as well. Is trimming actually dangerous for a tooth? Because like my tooth felt cold sometimes. It felt
Yes.
weird. Exposed.
So it depends on how much people have to trim.
Okay.
So if you have to trim a lot and your
Okay.
tooth becomes too exposed,
Okay.
so sometimes if you trim too much, okay, and sometimes it's because of the angle of the tooth. What
Okay.
happens is you trim too much, you actually hit the nerve, and then
Nice.
it becomes like super cold. Then you have to do
Yeah.
a root canal, then you
Yeah.
crown. So that you might need to do
But
a
the
root
trimming
canal.
was after the root canal.
The trimming was
so-
after, and you still felt cold.
A little bit. Then they put a crown. Then I feel okay.
Okay.
So am I supposed to sue my dentist or what?
I'm not. I see these lawyers.
Yeah.
No, actually, you're not supposed to feel cold, you know.
Okay, but now I'm okay.
Yeah.
So I
after
don't
root
know.
canal, you shouldn't feel cold because the nerve is
the
gone.
crowning is here, right?
Yeah.
And the crowning is supposed to make you feel okay.
The root canal is supposed to take away the coldness. So
Right.
I don't know why you still felt cold after the root canal. You should not, unless it's
Right.
from the teeth next to it.
Right. I see. But the crowning is fixed, right?
Yeah.
It will never go off.
It may wear out and leak after 10 to 15 years.
Okay, but I guess hopefully by then we're all in heaven. See you all next. Alright guys, you know what? Ulcers can happen anywhere in the mouth, right doctor?
Yes.
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 So what is so special about ulcer on the gum? Is it normal and common? What is your take on that?
So ulcers can be benign,
Yes.
and it's very, very normal if it's painful and it disappears after 1 month. Okay?
right.
So maximum is like 1 month. But if it is not painful and it is constantly there, I think like these are the two main factors. When it's not painful and you see it there and it just doesn't heal, this is really something that you need to get checked out. And
Okay.
we really need to bring this into awareness because sometimes it's not just looking like an ulcer, it can also look like gum disease. So if you have
Right.
like this red patch, right, that
Right.
looks like gingivitis or gum disease, it
Right,
just never
right,
heals.
right.
And it could be ulcerated, it could be non-ulcerated. We really need to inform you. It's like a mole check. So you need to. So I'll just show you this case, okay? And
right.
we're sharing this with permission from the patient.
Okay.
So he had like this ulcerated. It looks if at first glance,
So it's
it
yellow
looks
colour,
like
is it?
gum disease.
Also those yellow color, right?
It's like a bit whitish. So
Okay.
it's like just non-healing for a while. So we
Okay.
had to take a biopsy.
Okay.
So we sent it to an oral surgeon. They took a biopsy and turned out to be cancer.
Cancer.
Yeah.
In the gum.
So, in the gum, and it spread to. So it's called squamous cell carcinoma. You can get it on the skin. You can get it on the gums. And in this unfortunate patient, it spread to his bone. So he had to have half his face taken out.
Oh.
Yeah, so it's sad,
Half
but
his face taken
he's
out?
yeah, he's
How?
alive and well,
Well,
half his jaw, like the whole upper jaw is like gone,
wow.
and he had to have radiation after this. So do check your own mouth. It's like, you know how dermatologists get you to like check your mold. You should really either check your gums out, check
but
under the
if-
tongue, check.
I mean, like if you have, I mean, like okay, like when I had my root canal infection and stuff, so right, there was also like an ulcer on my gum because the bottom has an infection, right? And then once my root canal was solved, it's solved as well.
Yes.
It's gone.
Yes.
Thank God it's gone. So how do you check, and when do you know that it's time to see the dentist or to check it out? It could be cancer or not.
So ulcers, in general, if you see a dentist every 6 months, a dentist should give you an oral check as well. So
Okay.
sometimes it's underneath your tongue and you don't notice it. And if you're more wary, and if you want to do it yourself at home, what you can do is like look in the mirror, lift up your lips, actually like look inside your mouth, make sure your
okay.
gums are pink and firm, and you don't see any red swelling or even like white patches in your mouth. And do look underneath the tongue as well, so you can really give yourself like an oral cancer check. So it's like how
Wow.
the dermatologist tell you to check your moles to make sure they don't look weird. Same thing for the mouth. Don't
Okay.
don't leave an ulcer there basically. Especially if it's not painful and it's been there for more than a month.
So if an ulcer in your mouth hurts, it's okay.
Usually that's okay. If it hurts and it disappears after 1 month, it's not a big deal.
Oh, thank goodness, mine
Yeah.
always disappears in less than 1 week.
Are you healthier?
Yeah, means I'm steady. Yeah.
You're still young, that's why. So your regenerative cells are like going like full power, right?
Really? What do you mean?
I think when you're older, your regeneration slows down, right? So you need to like stimulate it by exercising.
I can think of the word Wolverine. When think about regeneration, because he has the power to regenerate. You know
That's why
Wolverine.
he looks so young.
Who, Wolverine? I thought me, yeah. Alamak, not me. But I take a lot of vitamins, yeah. So what vitamins do you take? You can share some like
I'm
A, E, B, C, D, E.
I'm big on D. I think the rest of the stuff you can get from food. But because I don't want to go into the sun because it gives me pigmentation, right? So I
Right.
just take vitamin D.
So she's big on the D, on the vitamin D. So I'm big on the C, on the B, and the A, I think. Yeah. Oh, I mean that sounds so wrong, but stop laughing. Oh my god, that was wrong. I didn't mean that way. Well, okay, guys, that was on about your gum ulcers. Stay safe from ulcers. Do get checked fast, and I believe you're gonna be safe. No ulcer in this place. Well, this place is a place of victory. Take care. So when you do your treatment, you pop the dirt, is it?
Yes.
Like what do you do?
So it's literally like a jackhammer, but it doesn't hurt because we've given you an injection already. So we go in and we blast out the dirt.
Is that the same as under what they call general cleaning in the dental
Ah,
treatment?
so that's very clever. So general
Right.
cleaning, they clean the outside, but this one we go underneath the gum. I got video, you want to see?
Yeah, sure.
Okay.
Like, but it looks the same.
So general
All the way.
cleaning, they will clean the tartar on the outside, which is usually light yellow.
Okay.
But once it goes inside the gums and there's not enough oxygen, it turns black. Okay, so it's like blackheads. You know the comedones when you squeeze out, it's like white on the outside. Then you go really deep, it's like black. It's like blackheads. So
Okay.
I love watching it pop out, by the way. So this is something that I just watch. So after we clean up the gums, right?
Yeah,
So we need
right.
to make sure it doesn't come back again. So you'll be put through a round of oral hygiene instructions. So we teach you how to brush.
Oh, okay, right.
Yeah.
right,
So
right.
you want to know?
Yeah.
Okay,
that-
so
that-
like
that's
you
good,
can do
that's
this
good.
as like
That's
a
interesting, let's do it.
prevention, or even if you've had gum disease,
Okay.
you want to be able to make sure it doesn't come back, right? It doesn't recur.
Yeah.
So the most important thing is that the bacteria seeps into the gums to this gum line. So the pink and white junction.
Yeah.
So that's where all the stuff gets stuck and it starts to seep in. So in order to brush it, you cannot just brush your teeth. You need to brush your gums. But you don't brush too high. You're brushing the junction, that pocket where all the food gets stuck. So you need to put it 45 degrees like this into the gums, and then you massage it. So like you do like jiggly motions.
You do that? Wait, you mean you do this?
Yeah.
Not like this?
No.
You don't do that?
No.
Dude, why have you done this to the wrong state? There's different stuff all the time.
Dentist.
Yeah. They said if you do this, the food will not go away.
No, you no. I studied for like 7 years. It should be correct.
Okay, I'll try a new one tonight. Alright, let's go your way.
Okay, so you 45 degrees and then you massage it and then you overlap it and then you go like this again. So you just keep overlapping it and you just make sure that, like if rice is stuck over there, you need to like slowly, gently cleanse it out. So it's like there's even a name for it. It's called the Bass technique. So you clean your teeth and then you go all the way to the back, you make one round, then you open, you start cleaning it inside. So never ever forget to clean the inside and clean the side next to your tongue.
Yeah.
The placement is super important. You need to put it into that pocket, which is basically the junction of the gums and the tooth, the pink and the white part, and then you just like massage.
Dude, I wish she's my mom. Then like we can have great dental health all the time at home for
I
free.
really could be. So that's the initial phase. You prevent the disease from getting worse.
Okay,
right?
yeah,
And then after
yeah.
that, we reconstruct. So that we rehab. So we're talking about like the regeneration just now. So now we're
right.
trying to replace what has been lost.
Okay.
So we will regenerate the bone and the gums around the teeth through the methods that we talked about. But sometimes if the tooth is already lost, right? So for example, the tooth is extracted because the gum disease is too bad.
Okay.
Then we move into dental implants, which is also part of our treatment plan to actually re-establish your bite and aesthetics.
So that's about the treatments. Now, Dr. Marlene, I want to ask you. So there's all gonna be all the disease, all the problems, all these issues. They have to see you. Then how do you prevent it? Prevent such nonsense.
Okay. So first, keep yourself healthy. So listen to the doctors, exercise, as within, so without, right? So make sure you're healthy so that even if you don't brush that well, you're not susceptible to gum disease. That's number one.
Healthy.
Healthy.
Okay,
Number
healthy.
2, brush your teeth twice a day, right? So it's very simple. Use the same techniques that we taught. Make sure you brush very well. Floss to get into the nooks and crannies that brushing cannot get into. And see a dentist every 6 months. You'll be surprised what not seeing a dentist becomes very costly after a while.
Right.
Because by the time they see me, usually things have bombed. So if you have gotten to see a dentist every 6 months, and you start from young, you shouldn't end up with so many
What's
issues.
next? So you got to see dentist, stay healthy, brush your teeth, floss your teeth, and then what's next?
That's it.
No, that's it.
That's it.
No, that's
Simple.
all. Simple and easy. That's amazing, really. I learned a lot. I gained a lot. Hopefully, you guys gain a lot as well and learn something new. Free advice on YouTube by Matt Talk Singapore. And so, remember, guys, you want to see more of Pak Min Hyung? Go to Undental and get your teeth and mouth checked. If you got dirty mouth, you better go and get it clean. But if not, put down the comments down below. Don't forget to like, share, and subscribe to see more of Pak Min Hyung and Joshua David Samsriwi. And together, Doctor, we'll see you again in the next episode of Doctor Say One Home!